It's money that didn't used to go down to a community organization, and I think it's money we all greatly need.
The federal government has partnered with the Quebec government to provide $86.8 million over the next 4 years to address addiction, reduce substance use harms, and the prevention of overdoses.
We are doing this to save lives, to bring people to a place of healing and wholeness.
The fact that we're having funding from the federal government for 4 years, for the first time, enables us to provide funding to clinical projects, to services to the population, including through the organismes communautaires.
This federal funding will support more than 96 projects in the province based on the needs of each region, and each of the services and programs are selected by the Quebec government. 76 selected are clinical projects that will provide direct services such as those provided by the organization Lionel that has 2 mobile injection sites on buses that are set up throughout Montreal.
The main issue is that the improvisation of those substances is fluctuating quite a lot. So someone could be getting like what is their usual fix one day, and then the next day it's way more potent, so they're unable to adjust the dose like in real time, and that's what causes what we're seeing today in the overdose crisis.
Lionel, what they'll be doing, it will be circulating in the streets of Montreal, not only the center of the city, but all around the city, to provide services, drug testing, giving tools, clean tools to people who want to use drugs, and as well as, when there's overdoses as well.
There's an illicit toxic drug supply that is so deadly and so dangerous that without organizations like Lionel doing the work every day in community, out on the streets, meeting people where they are at, to provide them with harm reduction.
Lionel will receive $2.5 million over 4 years from this federal funding. The organization also has a 3rd mobile unit to respond to calls.
The other mobile we have works on calls, so people need to use, they call us, and if we're available, we go to them, or we go to them once we're done with the people we're seeing.
There are also 20 research projects receiving funding that are overseen by various institutional and community partners, aimed at developing new knowledge about addiction and substance abuse.
What we need to do is to better organize services so we can get people, stop using the drugs. We have to do everything together, safe consumption, but as well provide more services to have them free from these drugs.
In Montreal, Gareth Madoc-Jones, City News.